Nutrition Intervention, Overview, and Definition. This module is based on the Electronic Nutrition Care Process Terminology 2015 edition and is prepared by the Nutrition Care Process team, a joint project of the Nutrition Care Process and Terminology Committee, the NCPT Workgroup, and the NCPT staff. By the end of this module, the participant will be able to understand a working definition and purpose of nutrition intervention, and understand the components of a nutrition intervention, including activities of the nutrition and dietetics professional during nutrition intervention, the critical thinking skills that are useful for planning and implementing the nutrition intervention, and finally, sources of data needed for decision-making during nutrition intervention. Nutrition intervention is the third of 4 steps in the nutrition care process. The purpose of the nutrition intervention is to resolve or improve the nutrition diagnosis or nutrition problem by provision of advice, education, or delivery of the food component of a specific diet or meal plan tailored to the patient's needs. The process involved in nutrition intervention is to plan and implement the appropriate nutrition intervention based on the nutrition diagnosis and etiology. We will describe in depth these processes in this module. The critical thinking skills needed for planning and implementing a nutrition intervention are setting goals and prioritizing, defining the nutrition prescription or basic plan, making interdisciplinary connections, initiating behavioral and other nutrition interventions, matching nutrition intervention strategies with patient needs, nutrition diagnosis, and the values of the patient, choosing from among alternatives to determine a course of action, and specifying the time and frequency of care. Components of nutrition intervention include 2 phases, the first of which is the planning phase. In the planning phase, the RDN prioritizes the nutrition diagnoses that is based on the severity of the problem, safety, and the patient's needs. In the second phase, the implementation phase, the RDN carries out and communicates the plan of care to all relevant parties. To plan the nutrition intervention, the RDN must first prioritize the nutrition diagnoses, as there may be more than one nutrition diagnosis. The dietitian will need to determine which nutrition diagnosis is the most relevant nutrition diagnosis to consider first. Also during this phase, it is a good idea to consult the Academy's evidence-based nutrition practice guidelines to determine the steps that should be taken in the intervention phase. It is also important to confer with the patient and caregivers to determine their specific goals and negotiate with them. The nutrition prescription identified must be detailed and the strategies identified. The plan will also define the time and frequency of care. Nutrition prescription refers to the patient's individual recommended dietary intake of energy and/or selected foods and nutrients. This prescription will be based on current reference standards and dietary guidelines and the patient's health and nutrition diagnosis. There are 2 phases of the implementation of the nutrition intervention. First is the action phase. The action phase includes communication of the plan of care, carrying out the plan, and continuing the data collection of the patient's response to the plan. Finally, the ongoing aspects of the implementation phase will be to individualize the nutrition intervention based on discussions with the patient and caregivers, collaborate with other colleagues, follow up and verify the implementation, and adjust the intervention strategies if needed. The Electronic Nutrition Care Process Terminology Reference Manual includes a reference sheet for every nutrition intervention. Each reference sheet includes the nutrition intervention term, definition of the term, descriptive details of the nutrition intervention, the nutrition diagnoses with which the nutrition intervention may be used, and additional considerations pertinent to the nutrition intervention. It is a good idea for the RDN to become familiar with the nutrition intervention reference sheets during the planning phase of the nutrition intervention. In summary, customized nutrition interventions based on the patient's needs, identified through nutrition assessment and nutrition diagnosis, are available in the online ENCPT reference manual. Also, using defined nutrition intervention terminology assists the professional in communicating among all healthcare providers the nutrition interventions that maintain or improve health and minimize disease. In the nutrition intervention step, the RDN collaborates with the patient to plan the nutrition intervention and implement and modify the nutrition intervention as needed. Continue to the next module for a discussion of the nutrition intervention terminology and use.